what is the complete life cycle of Indian student moving on to US for USMLE?
There are 3 steps to the USMLE. There's step 1, which is...
Now, everybody says that USMLE is totally worth it. Everything is just amazing. Money, jobs, lifestyle, respect. Now, do you agree with this fact?
The money is great, Dr. Bhatia, but
do Indians face racism in the United States?
It's very much dependent upon where you end up.
Do you think that the Trump administration, the new rules and policies that they are creating, it is going to affect Indians immigrating to US?
They are trying to preserve American jobs.
That how much a resident can earn post his post-graduation?
The highest compensation that I've ever seen is for neurosurgery, which is close to $+ plus.
We are building India's largest community of medicos. But before I go forward, I do have a complaint. 93% of our viewers have still not subscribed. So before I go forward, guys, subscribe to the channel so I can get more and more interesting people to solve all the misconceptions of the medical world. Today's topic of discussion, again, very interesting, USMLE. There are so many myths and misconceptions around this topic. How to approach, what is the best time to start with step 1, best time to give step 2, the perfect preparation strategy, and how to actually go with the research and the interview part. We know there are so many problems, but hardly any people around to solve these problems. I have the perfect guy for you. He's a psychiatry resident at Penn State Health Milton S. Hershey Institute in Pennsylvania. He's a graduate from Kempegowda Institute of Medical Sciences in our own city, Bangalore, and he's an amazing person. He's a content creator who has inspired me to learn about more and more about USMLE, and he has been guiding USMLE aspirants for last 4 to 5 years now. I think you have guessed the name by now. He's Dr. Manik Madaan. And we had a very interesting discussion covering everything you need to know about USMLE. So get your facts together with Dr. Manik Madaan. Hey, Dr. Manik, thank you so much for taking out time for this podcast. Very excited to have you here.
I'm very excited to be here, Dr. Bhatia. I'm a big fan.
Thank you.
Yeah.
And let me tell you that, I just told you while we were talking before the podcast that, whenever a student asks me a question about USMLE and whenever I am confused, I simply open up your videos and I always get an answer. So you are doing some fantastic work, letting the world know about USMLE and all US-based issues.
Thank you so much. But do you make them subscribe? That's my question.
I think that will be my job after this podcast.
Please. Yeah, thank you so much though. Yeah, I really appreciate that. Yeah. I've tried my best to cover all USMLE topics from step 1, step 2, step 3 to all the way to the match process, interviewing, and I really appreciate all of this. Yeah.
I think you are the kind of senior every USMLE aspirant here is looking for. Because, there's so many questions, so many myths and so many misconceptions about USMLE and I would say all the foreign examinations, and people generally do not get to meet the right people to get the right answers. So I think through this podcast, I'll try to cover as many, and I'll tell you, I've got more than 1,000 questions from our audience about USMLE. So that's the craze that is going on right now.
So this podcast is going to last 24 hours then, like 1,000 questions. Oh my God. Okay. But I think the most, I would love to answer the most commonly asked questions in terms of the misconceptions about the process, because there's a lot of them, like, we were talking about. So, let's get started. I'm excited. 1,000 questions. Let's do it.
All right. So we are not going to ask you 1,000 questions. So we have summarized and we have a limited number of questions.
Okay. Oh, nice. Okay.
So Manik, how did you get into MBBS, and then why did you opt out of the NEET PG regime and thought of trying for USMLE? That's the most pressing question here.
Yeah. So first of all, to address, so it's a 2-part answer, right? First of all, how did I get into MBBS? Where did I go? And then secondly, regarding USMLE, like going into the USMLE realm and the NEET PG. I actually went to the NEET PG route as well, and then took a U-turn. So that was like how I drove through it. But yeah, in terms of going into MBBS, so both my parents are doctors. My dad's an orthopedician, my mom's an ophthalmologist. So I was I started exploring medicine at quite a young age. I was lucky to have my parents, who are doctors, because when I was I think it was in my 6th grade or 7th grade, I was having some kind of very obsessive thoughts. Like I couldn't understand why I was having these thoughts, where if I touch a few things evenly, I will be lucky. If I don't touch a few things evenly, I'll be unlucky, right? And these thoughts got to the point that I was stuck in my school because I was left touching my desk unevenly. So I touched it 9 times, but then I think I lost count. And I was like, if I don't do it right, I'll be unlucky and something could happen to my parents. I remember that moment. I was like crying. I couldn't understand what's going on. I also had this habit of like washing my hands multiple times throughout the day for some reason. And if I didn't do it right, if I got some germs on, people could die. Right. So I hid this problem for quite a while. And then I told my dad about like, I've been having these crazy thoughts. I don't really understand. And he took me to a psychiatrist. When I went to the psychiatrist, he was like, you definitely have OCD, obsessive compulsive disorder. And they started me on Luvox, which is SSRI. And once I started Luvox, it completely changed my life, right? Those thoughts went away. I started CBT, cognitive behavior therapy, which I'm telling you is such a game changer. Like CBT is not just for OCD, it's also for life. If you can know how to reframe life events from negatives to positive, if you can change your mindset, that's everything in life, right? So I learned about CBT, I learned about SSRIs. I was like, that changed my life. I no longer was crying. I no longer was the boy who was stuck in school, missing his van because I was touching things unevenly or evenly, or washing my hands. And because of that, I was able to continue my high school studying, right? I was able to write NEET even. I didn't perform that well in NEET. At that time, there was an exam called COMEDK, which was for getting into private colleges in Karnataka, Bengaluru. And I didn't do that well in NEET because I was a guy who had so much anxiety for some reason, like, in the coaching realm, 24/7 studying. If I don't get into med school, I don't know what's going to happen. My life will end. Then so I didn't perform that well because of I think it was part of the anxiety and part of maybe not being prepared as well. Then I just went to Bangalore. And I was just blown away, like for COMEDK, right? To write COMEDK, because you can only write in Bangalore. I was blown away by the city vibe, right? Like living in the city, big malls, people in tech. And I was like, I want to stay here. So the next day was my COMEDK. I remember I went there with my mom. And I had no tension. I went to Bangalore with the mindset of I'm going to relax. And that relaxation caused me to score really well on COMEDK. I think I got a rank of 400 or something. And that got me into KIMS, which is it's a private college, but it also has public seats. It's one of the best colleges in Bangalore. So I think BMC is number 1. Then Ramaiah and KIMS are number 2 in Bangalore. The fees was all right. I think I paid 4 lakhs a year, which is not a lot right now for a private college, right? But KIMS was, that's how I got into MBBS, right? So got into KIMS. And the best part, I can tell anyone, is that if you're choosing a college, I think location. That I cannot emphasize more upon, because I think the reason I became successful in the USMLE realm and YouTube realm and public speaking realm was because I was exposed to people who were very ambitious in a city. We had startup events happening all the time in Bangalore, right? I would go to startup events. We would learn how to build startups, business. And there were people in tech who would teach us how to code in Python, right? And AI was coming up and we would learn about AI. I remember you could start your classes. So I used to teach public speaking classes in Bangalore, so Bangalore, I think that location was such a prime thing in my life that the college was great, but the location was the biggest catalyst, I think, for my growth. So that's the story of how I ended up in MBBS. But then how did I end up into the USMLE race and not the NEET PG race? I had a senior who was preparing for USMLE at this time. When I was in my second year, and he started introducing me to some resources like Kaplan, and he told me about like the US, what was happening. I wanted to become a psychiatrist before I wanted to just become a doctor, because psychiatry had changed my life. And at that time in India, psychiatry, I think it was growing, but it wasn't to the point that we were at the cutting edge. Like we didn't have TMS or SAINS protocol, which is like 80% remission rate for depression. That's Stanford accelerated protocol, right? So I had this issue with OCD that was partially like fixed, but I was like, what else can I do? Where else can the science go, right? And in India, I wasn't able to find that answer. So I was like, look, the US is having so much research, right? I want to go to the US to be at the cutting edge for psychiatry, right? Which in the US is happening right now. There's medicine 2.0, medicine 3.0 coming up, medicine 4.0. So 2.0 is preventative plus individualized medicine. 3.0 is deep medicine, which is using AI. And 4.0, which is the last level of medicine, is called as quantum medicine, where we'll be using quantum computers to do crazy things, right? So this was coming up. So I was like, I need to be in the US, and that's the only place I want to be. So I started preparing for step 1 in my second year, and I got Dr. Najib's videos. So he was the one I started preparing from. And then I think I had other resources as well that my senior recommended, from Kaplan to I got Boards and Beyonds as well. Sketchy, that's a great resource for step 1. Question banks like UWorld. I did though like take my time, because my senior told me take your time for step 1, because at that time it was code. So I took it after MBBS ended in my internship, right? And then like step 2 came along, and then I ended up going into psychiatry in the US. But I also wrote NEET PG, because my dad was like on my, he was like, "Tu USMLE likh raha hai, backup rakh apne saath," right? You have to keep backup. So I ended up like zero preparation for NEET PG, just was preparing for step 1. I remember sleeping like 4 hours for NEET PG exam, went there, no idea, just like went through all the questions, and then I got a rank of 4,000 something. NEET PG Air, right? Which was insane to me. So I think that just like, because I think that just reinforced the need to do USMLE even more, because the focus on concepts that they have, right? Systems level thinking, or what do you say? Like Elon Musk says that, right? Like there's systems level thinking and first principles thinking. USMLE focuses on a lot of, like, for example, agar hum embryology kar rahe hain, how do you derive all of anatomy from embryology, right? And that just like makes anatomy stick in your head forever, right? If you know like celiac artery, where is that derived from? So superior mesoteric, superior, like there's different trunks, superior mesenteric artery, celiac artery. If you know primary gut derivatives, secondary gut derivatives, if you know these, you can tell which artery is supplying what. So that in USMLE, like the first principles approach helped me score very high on the NEET PG as well, right? So I was like, this is what I want to do, is because just I love first principles, I love building concepts. And I think that's why. But I think NEET PG is now becoming like that as well. Correct me if I'm wrong.
Yeah, the systems are changing. Systems are changing.
Yeah.
They're going towards more integrated approach, just like USMLE has been doing for like so many years. So I think the next that they had also planned, the next exam that was supposed to come, that was also planned on a similar approach itself.
That's so interesting that we are moving towards that integrated approach, right? Like, okay.
So Manik, about USMLE. Now, everybody says that USMLE is totally worth it. Everything is just amazing. Money, jobs, lifestyle, respect. Now, do you agree with this fact? Have you seen that transition coming from India to US?
So the money is great, Dr. Bhatia. But what's even better is the lifestyle. So let me give you an example. So currently I'm in psychiatry residency, right? I'm in my residency, number 1. Number 2, guess how many days of the week am I actually working?
I'll say 4.
You've watched my videos. Okay. I do work 4 days. Right. So I have the weekend off, which is Saturday, Sunday. And then Thursday is pure didactics, where all they do is we don't do patient care. All we do is education, right? Which is not even working. So I'm technically working just 4 days a week. And even during those days, let me tell you how it actually works. So I go to the clinic at 8, right? And then I'm free by 11. So 8 to 11, I'm working. So 11 to 1, I'm free. And then 1 to 4, I'm also working. So I'm actually working 6 hours every single day. And into 4, I'm working 24 hours a week, which is crazy to me. Right. So that allows, like, first of all, like, I don't feel drained because of this. And because of that, I can go into USMLE ventures, right? Like making YouTube videos, making Instagram reels, and also learning, right? If you're working all the time, you don't have the mental energy to learn other skills like business or video editing. I have the time on the weekends to do that, right? Which I wasn't getting in India as a student, right? The concept of a weekend, I don't think it exists in India as much as it does, because we work Saturdays, right? We that's what I remember from a med school. Sundays are free, Saturdays we work. Here in the US, everybody gets Saturday, Sundays off, except in internal medicine. Sometimes you don't, because it's more hectic in the US. But especially as a psychiatry resident, I get so much time off. Lifestyle wise, I'm paid enough that I can have a really good car, right? Currently, the car I have is not to flaunt, but it's 25 lakhs, right? And I was able to that's the minimum basic car you're going to get in the US if you want a new car. But that car has everything I need. It has autopilot, which is if I press a button, it'll take me from point A to point B without me intervening. So it can drive by itself, right? At that point.
So basically you're driving a Tesla, right?
It's a different car, so it's not just Tesla. Other cars have also come up with autopilot. So I'm driving a Hyundai which has autopilot like features, which can drive itself, which is crazy. So I'm able to afford that with whatever salary I'm getting as a resident. And also there's a lot of events here in here residencies. They will organize get-togethers and meetups about every month where they'll pay for it and they get you together in a restaurant or a bar, or they'll take you out for a laser shoot or laser hunt. And treasure hunts. So there's a lot of fun that's going on, and I don't feel burnt out. That's what I can tell you from my perspective in terms of lifestyle. So that is true. Lifestyle in the US is way better than what I've heard from other people in India. Like my friends in SMS Jaipur, like his lifestyle was working 7 days a week, right? And you can see the white hair coming that he's getting. I have 3 white hairs because of some calls that I do, 24-hour calls, but I would say that the US is lighter on you in terms of lifestyle.
So I have seen the USMLE lifestyle, the residency part in Scrubs, Grey's Anatomy and everything. Now I see a lot of toxicity happening to the new residents in that show. Now, is that part true for you also?
That's a great question. It really depends upon the kind of hospital you are in, right? So I'm being totally candid and transparent here, what most people won't say. So there are 2 kinds of programs. One are academic university level programs, which are part of the elite. And then there's malignant programs. These are more like not all community programs, but these are more community programs which don't have university affiliation. The difference here is this. If you're a university, you have funding from the National Institute of Health and other parts, right? You're rich. So you don't need to make money from the resident as much, right? And you can dedicate your time to teaching the resident. So here, your academics are valued more than you just giving patient care, or you becoming a rat for them, or you becoming a money-making machine for them. In malignant programs, which tend to be more community programs, again, not all community programs are malignant. What happens is these programs don't have funding, right? And they don't come from rich places. And this happens a lot in New York City, where a lot of IMGs match. What you will see is these IMGs start becoming the money-making machine, because all they want is somebody to make the money, and what takes the backseat is their education. Right. So it really depends upon what hospital you match in. The hospital that I am in, I'm very lucky to be at a university program. And here, for example, if I want to take off, I can easily take off because the attendings can function without me. That's how the program's built. They are not making as much as money as they're trying to teach me. Right. Versus if you see some like malignant program, right, where interns go, there are programs where you work 100 hours. Versus my 24 hours, right? So it really depends upon if you go into a community versus university program, right? Again, there could be some university programs that could be malignant, but this is the generalization that I can put in a simple perspective is the all of US is different. There must be cases like what you're telling me. There was a case in I think. New York City, where somebody committed suicide because they were being made to work 100 hours. And the issue is, if in the US you want to quit residency, right? You're burnt out, you lose your visa. So you're sent back to your home country. So you're like in this very tense position where you have to work, right? And you're getting burnt out. But if you quit, you lose everything. Kind of, right? In India, though, you can like take some off. You won't technically lose the seat, right? In here, you will lose the seat. So that's the kind of very fine balance that some people have to walk in malignant programs. But that's kind of the reality here, right? But let me just tell you, most IMGs don't get into the university places. They end up going into either decent community programs, which are not malignant, or malignant programs in New York City, where you will see many people complain that what I'm saying is incorrect. And that's why they think it's incorrect, right? So that's kind of the reality. It's more mixed, right? But there are also programs in if you go to the West, right? West is very relaxed. California, where residents are working even less than me. I have call, 24-hour call every 10 days. There are residents in California who have no call. They make way more money than me. So that's kind of where it is.
Okay, I wasn't sure that if it was possible to actually work less than you and make more money, but you are saying that's true also.
It is. So the US again is 50 states, right? So each state is different. And I think unlike India, where there's like a national, you take a national standard and then you distribute it across the whole country, where it is kind of everything is similar to the national standard. In the US, it differs massively. It's because everything's private. So the whole US is private. So it's how rich the private body funding your university or community program is that determines how much you make and how less you work.
I'll ask you a very controversial question in the very start of the podcast, because whenever I talk to somebody who is abroad, I think this is one of the first questions that comes into my mind. It's a very simple question: that do Indians face racism in the United States?
Racism again. US is 50 states, right? It's the United States of America. And it's very much dependent upon where you end up. Number one, let's say you end up in New York City, right, which is very diverse. It has a lot of brown people. That's how we term Indians, Nepalis, Bangladeshis, right? A lot of Asian people, a lot of Mediterranean people. And it's mixed, right? The white population there isn't as much as other places, and there literally is no racism. You will see intercultural marriages where Indians are marrying Italians are marrying the black population. We can use the word black, by the way. That's how US they use it. So in New York City, you will see no racism. Or if you go to other cities like San Francisco or Chicago, there's literally no racism. But the more you go towards rural areas and the southern part of the US, you will start seeing elements of racism because the white population starts increasing. And they might not be as aware, right? Because the diversity isn't as much. For example, if I'm let's say I go to Texas. Texas has a big white population, right? I'm not talking about Austin, Texas, but the rural parts of Texas. These people, I think just based upon the basis of innocence, right? Like, for example, we are brown, right? If we get like some white person living with us, we'll like kind of single them out. Okay, that guy's white. They also could be more innocent in terms of they'll be like, oh, that's a brown person. And they might say things that we look to you more racist, but they might not be. But some people are actually racist, right? Where they'll be like, go back to your home country. You don't need to be here. In my experience, I have not noticed any racism where I live. I'll be very honest. Especially if you're working in a hospital, there are so many brown people in all hospitals, right? Medicine here is infiltrated with first generation and second generation Indian population. If you look at UWorld, do you know that the person who made UWorld is Indian? And First Aid, the person who made First Aid is also Indian, right? So all the Indians are at the apex of medicine, and because of that, in the hospitals you'll get so many brown people, and because of that, there doesn't tend to be racism that I have particularly noticed. We are very well accepted. And let me ask you another question. I think that I want to ask is, can you tell me another country in the world where if you can speak their language, right, at least not you can have your own accent, but you can speak their language and they will mistake you for their own citizen in the world?
I don't think so.
It's the US. So in the US, right,
Apart from US, yeah.
apart from the US, there's no other country. If I go to India and I speak perfect, like not me, let's say a white person goes to India and they try to learn Hindi, everyone will be like, you're definitely not Indian, right? But in the US, if a brown person comes, right, and they're able to speak English, everybody, like nobody will know if they are whether they're citizens or immigrants, right? That's like the beauty of US is that there are people from all over the world, right? And sometimes the most ambitious people. So have you heard of the American dream?
Yeah.
So many people think the American dream is making the money, right? Having a big car and then a big house, Ferrari, whatnot, right? What I think the American dream is that America is literally the place like of immigration, right? It's the land of immigrants. And the people who end up here tend to be very ambitious. And the American dream is to work with such ambitious people, right? Not saying India doesn't have ambitious people. It's just that the way it selects people, for example, if somebody is coming from India, right, and landing in the US, they're going through the headache of immigration, the headache of like acclimatization to a new environment. That means that they have a level of ambition that's higher than the average person, right? Now think about that throughout the entire world. People from Japan, people from Singapore, people from Brazil, everywhere are coming to the US. So the pool of people you get are people who are generally tend to be very, very intelligent, right? And have very high ambition. And I think that's what I enjoy is like the startup culture, how things are progressing is everybody's thinking out of the box. How can we build a new company? How can we do this better? And the growth mindset is what's running through people's mind, right? Even if you're a son or a daughter of an immigrant, right? Most people here are immigrants. You inherit that mindset. And that's what I enjoy about the US. And secondly, just the diversity, right? So the racism is not as much as you would think. And I think US is the least racist country compared to, just summing it up, other parts of the world, where if you go to China, I can speak perfect Chinese. Nobody's going to accept that I'm Chinese, right? Versus in the US, they will.
Do you think that you have been in US for so many years now? So do you think that the Trump administration, the new rules and policies that they are creating, it is going to affect Indians immigrating to US, visas, and maybe moving on to PR and citizenship? Will it be a difficult process from now on?
So that is a great question. Number one, what's happening with the Trump administration is they are trying to preserve American jobs, is how he's putting it. That we want more internal jobs, and the view in America is all these Indians and other people are coming up and taking our jobs, and there's some hate. But what I think is, if you look at the tech sector, right, at least, or the medicine sector, the people who are leading these industries are Indians. If you look at the ex-CEO of Twitter, right, before Elon Musk got it, Indian. A CEO of Microsoft, CEO of Google, Indians, right? Then there's Vinod Khosla, who's like a big person here in tech. Like all these people are Indians. The biggest name in like medicine, right, here, UWorld, is Indian, right? So also in medicine, if you look at like a lot of research papers, most of them are immigrants and they're Indians, right? What I will tell you is this, right? The Indian work ethic is the most powerful thing in the world, right? We are taught to work 7 days a week. We are taught work is life, and that can beat any form of intelligence, right? When I came here, I was the only one working 7 days a week because I love it, right? My parents have done it. My grandparents have done it. And that's how we are built. We were built so well. So that work ethic, I think the US needs, and I don't think it's going to affect Indians as much as it might affect other countries where the US is, because India is like lottery ticket for the US. All the best and the people here, leading people, tend to be Indians. And you will see it in all industries, like Elon Musk, let's say Tesla, SpaceX, all Indian engineers. near about, right? So I don't think the Indian work ethic will ever be replaced. That's just like how we are built. So I don't think India would face as much as problems. But what could happen is this: if you have a green card, you might get more priority over somebody who doesn't have a green card, because nobody wants to go through the process of the headache of sponsoring a visa. An example I can give you is, for example, in my program, somebody went to their home country. It was Dominion Republic. When they went, they weren't allowed to come back.
I know.
And the whole program wasn't like, was like, what are we going to do now, right? So for 3 months, we were like begging the embassies to let that person come back, and then they did. But again, nobody wants to go through that headache of rescheduling their schedule and then filling in their schedule. So what with the Trump, what's going to happen is there's an internal fear that's being evoked in program directors, and I think they might prioritize green card holders, right, over somebody who doesn't have a green card. And that tends to be like, for example, in India, there's a lot of NRI studying. They might get a more preference. If you're more of, let's say, from the US and you're studying in a Caribbean school, which is these islands that are near the US, if you're working there, you might get more of a preference. If you don't have a green card, you might get less of a preference. That's like the big change I can see coming. But it's not something that is insurmountable in the end, right? If like somebody wants it, they'll definitely be able to get to the US if they have enough ambition.
So, Manik, thank you for that. Let's move on to the USMLE section now. How the preparation goes, what is the complete life cycle of an Indian student moving on to US for USMLE. So how would you say that post step 1, step 2, what's the procedure forward?
Okay. So first of all, so USMLE stands for United States Medical Licensing Exam, right? It has to be given by everyone across the world to become a doctor in the US, right? To enter PG. So being a doctor in the US is like PG. Here you cannot be a doctor without getting into PG, unlike what you'll see in India. And because of that, US medical students, Indian medical students, and anybody has to do USMLE. Even if you want to enter a fellowship in the US, you've done your PG in India, you have to do USMLEs. Without that, generally they don't allow. So there are 3 steps to the USMLE. There's step 1, which is preclinical. This is our first and second years. And then there's USMLE step 2, CK, which is clinical knowledge. This is our 3rd and 4th years, where we go into your pediatrics, medicine, right? And then there's USMLE step 3, which is the final exam. This you don't need to get into the US process. This you need to do after you match here, right? After you get into residency. So in terms of USMLE step 1, this is our like first year subjects. So physiology, pharmacology, biochemistry, and then second year pathology, pharmacology. And what I would say is for USMLE step 1 prep, the first thing you need to do is make sure you have your foundations down, because if you know first principles, if you know embryology, only then can you understand these. And that's how the USMLE tests it. And it tests pharmacology with physiology together. You need an integrated approach. The best way to do that is using first aid with a resource like Boards and Beyond, right, which is the go-to resource, and then testing yourself with UWorld. Those are the at least 3 main resources you need. The time you can write USMLE step 1 is only after your second year is done, which makes sense, right? You need your preclinical subjects done for you to do step 1. Then for step 2, you need, this is like I talked to you, like medicine, peds and whatnot. What people need to understand is that step 2 is basically preclinical knowledge mixed together very tightly. For example, what makes medicine? Medicine is physiology plus pharmacology plus microbiology plus anatomy, all of them mixed together, right? If your step 1 basics are not clear, step 2 is going to be very hard for you, right? Because we're building it. It's first principles. So having first foundation knowledge and then step 1 basics, and that will help you score very high on step 2. Step 1 right now is pass fail. So it doesn't really matter, but I would say you should think about it in a very numerical way, because if you don't measure it, you might end up losing on step 2, which is scored, and what matters for you to match in the process, right? Step 2, you can only give after 4th year, after your clinical subjects are done. So the USMLE is quantitative in terms of it tests your in terms of scores, your pass fail is step 1 and step 2, but it's also qualitative. You have to build your CV, right? This is a big difference that many people don't understand. Is in the US everything is more professional, job like for medicine, versus in India it's very student mindset, right? So if I'm giving NEET PG, my thinking is I should get a rank and that will get me into this specialty, right? In the US, it's not like that. It's a job process. Oh, that's like a score is only part of the process. What you need is research, which is if I want to go get into neurosurgery, I can get 270, 280. I won't match into neurosurgery unless I have research where I show my dedication there. I have interviewing skills where I can show that, hey, I can communicate well with the patients so that you won't get lawsuits. Because I don't know how to communicate, right? You also need to show your ability to speak English in terms of personal statement, building your ERA CV, which is publications and whatnot, volunteer experience in neurosurgery, if I want to get into neurosurgery. So that part should be going on even before your USMLE steps start, right? Many people think of, right, like in India, we think of sequentially, step 1, step 2, then I'll build CV. That's not the case. You have to build the CV while step 1, step 2 are going on. And program directors can see that, right? So that is very important to get into the US, building your CV. You can apply as soon as some people apply even in internship, right? For the match, you can apply near the end of internship. That's the earliest you can do it. And you can get into residencies. Now, many people, there's this misconception where people think you can't get into neurosurgery or very competitive specialties. You can match even into the most competitive specialties if it's not just the score. If you've built a good enough CV, and if you have contacts, you can get into the most competitive specialties, even such as like neurosurgery. It's possible.
So Manik, how would you say that what is the best score to get, like the appropriate score to get in USMLE Part 2, the CK, to actually get into a good residency match?
Great question. So previously, I would have said everybody should get 260s, 270s, because previously it was that was all that was required to even get into the most competitive specialties. However, about a year or two ago, there was a big cheating scandal in the USMLE where a lot of testing centers, people were sharing answers, and because of that, many people had inflated scores. Right, people were getting 270s, and when PDs found about this cheating scandal, right, a lot of people were sent back to their home countries because they couldn't continue, and that was a big issue. Since then, many program directors have focused away from scores towards a more holistic CV. Right. So currently, most PDs should be okay with more than a 250 plus because they know that scores are not the only criteria. You can even cheat in the USMLE, but I wouldn't recommend it because your score will get invalidated. But a 250 plus should get you into even neurosurgery, right, which is a competitive specialty or plastic surgery if you built your CV well. But that said, if you can score high, the higher your score, the better your chances will be. But the minimum is 250. On the step 2.
So you're mentioning CV a lot. How would you define a excellent CV? What should a student actually put in that CV to make it matchable?
Now, I think we're going back to the Indian mindset, right? The generalist principle, excellent CV. So in the US, there's nothing such as the excellent CV. What is there is the best fit CV, right? For example, if I want to get into psychiatry, now what they want to look is the coherence of all my experiences. That's telling a story where I want to be anything, not anything other than a psychiatrist, right? For example, let's say at age 15, I started reading books on CBT and I gave a class on CBT, right? That's a volunteer experience where I did it for free. And then suddenly I started doing research in my med school on psychiatry, OCD, depression, whatnot. Then I got publications in psychiatry, and I did some other volunteer events related to psychiatry. Apart from that, networking. Did I go to APA, which is the conference we have here for American Psychiatry Association? Did I go to those conferences? Did I present my research? Right. That's what matters to the program director more than me mixing it up. For example, I was at age 15 wanted to become a neurosurgeon. Then at age 20, I was like, no, let's do internal medicine research. And I published more than anyone in the world. Right. Then I was like, no, I want to do volunteer experience in pediatrics. Right. And then I applied to psychiatry. So you can see the difference, right? So there's nothing such an excellent CV. What there is the best fit CV for that specialty. Because what program directors here have found is this, that you can have the best person in the world, but if they're not interested or they're not passionate, right, उनमें आग नहीं है उस specialty के लिए, they don't perform as well and they're going to burn out. And we all know that if you don't have passion, right, you don't have the flame, fire, you're not going to be working on the weekends, right? True. For that specialty. So this is the most important thing, like in terms of building a CV, is first decide a specialty and then align all your experiences, your personal statement, your research, publications towards that.
So you were saying that a student should, basically an aspirant should start building his CV while he's preparing for step 1, step 2, and maybe step 3. So an aspirant needs to be very clear that which branch he's targeting in the US while he's going for step 2 CK exam. Am I correct on this mindset?
100%. That will help you more than a 270. If you can show interest early, because you would know it, right? Like you worked in a company, right? Who tends to perform better? People who are just numerically doing a lot better, or people who are just working weekends and they can't think about anything but that field.
So that's what is driving the US to a higher number every year. I think that's what I would say that's impressive.
No, I think that's it. But I think the number one thing you should do is have passion. Because in India, क्या होता है, we give into the societal values. Okay, maybe I should just become a radiologist because that's what everyone else is doing. And when you do that, you sacrifice passion. You're not just losing yourself. The world is losing maybe a great psychiatrist for a mediocre radiologist. And I can tell you one thing: if you want to make an impact, you want to even make money. Research has shown over and over again that the number one predictor of success is grit, which is passion plus perseverance, right? And you can only persevere if you're working on the weekends, if you can't think about anything but that specialty. So a psychiatrist who's passionate about psychiatry will do way better than some mediocre radiologist who doesn't want to work weekends and all she wants is an off. And that's what the US is driving the hiring in the US too. Right, I want to hire people. If I build a company who want to work weekends, right, and it's actually recharging for them, working on the weekends for that specialty or for whatever they're doing, and that is the biggest predictor how well my company will do or the hospital will do, right? So I think that's the most important thing you can do is first figure out what you're passionate about.
So Manik, let me ask you a question here. I think there are a lot of misconceptions around this question, especially. How would you rate the specialties in a parameter of difficulty in matching? I have heard, as you just said, that neurosurgery, people always think here in India that for Indians especially, neurosurgery is impossible to match. So let's rate 1, 2, 3, 4, 5, 1 being the hardest to get into and let's suppose 5 being the easiest to match into.
So let's start with the hardest, right? Like, and then the easiest specialty. So generally you will see, and I'm making a broad generalization here, surgical specialties tend to be the hardest to match into, right? And anything that's non-surgical is relatively easier. There are exceptions to this, like radiology. So currently the hardest specialty that we have looked into is neurosurgery, number one, because you can, like, for example, the pay there is $1 million a year minimum, right? To 2 million, right? Secondly is plastic surgery. That's going big in the US because we have the internet, TikTok, everyone's looking at each other's makeup routine, right? So plastic surgery is up there. Dermatology is like it's an exception, even though it's not a surgical branch. Here you can make $600,000 to $700,000 minimum if you're a dermatologist. Radiology is it's not as hard, but ophthalmology is relatively harder in the US. otolaryngology, ENT is here. It's very, very hard to match into. I think this was the second hardest specialty or third hardest specialty this year. In terms of the easiest specialties that IMGs can match into international medical graduates, it's internal medicine. That's the most, like funnily in India, that's the most competitive. Here it is the easiest specialty to match into. Second is family medicine. Third would be pediatrics. Fourth, I think, would be neurology. And fifth, from the data that I saw was pathology somewhere. And psychiatry, right, would be also is something that people apply to and is possible. Yeah.
The question is simple, that list down the branches and the commercial values, that how much a resident can earn post his post-graduation, and you can start from the highest to the, I wouldn't say the lowest here, but the least financial branch in the USMLE.
Okay. So the highest compensation that I've ever seen is for neurosurgery, which is close to $1 million plus right out of graduation. And then I think the second highest would be cardiothoracic, which is $900,000. The third highest would be, I think, the third highest, I think, would be plastic surgeries, $700,000. Fourth highest, dermatology, $500,000. Fifth highest, I think, is ENT with like 500, some near dermatology, $500,000. And then sixth highest would be radiology with $450,000. Seventh highest would be neurology with $400,000 minimum. Eighth highest would be psychiatry, where I've seen 350 to 400. The ninth highest, I would say, is internal medicine, which is 300, something near that. And I think one of the least paid specialty would be pediatrics and family medicine, which is more along the lines of 280 something.
I think
280,000.
Yeah, still a lot. So how would you rate the universities in the US for residencies? I would say, I mean, I don't know the right term that you use, universities or hospitals. So how would you rate the top university to, let's suppose we have to list down top 5. How would you rate those universities?
Okay. So first of all, we have to think about ranking them in terms of the specialty you're going in.
Right.
There's a place called Doximity, which gives out rankings. And this is based upon the program. For example, you might have the best university, but for example, Harvard, but it might not be the best in terms of psychiatry or neurosurgery, right? So it's based upon the rankings are based upon your department. How well esteemed is the department? How good is the training there? So you could have the best in plastic surgery to be UPMC, which is University of Pittsburgh, not Harvard. So that answer depends upon where, what specialty you're applying for. For my own specialty, like psychiatry, I think the number 1 right now is Harvard. Second would be Yale University in New Haven. Third would be Columbia University in New York City. Fourth would be UCSF. Somewhere there. And fifth, I think, is UPenn, University of Pennsylvania, so these are the top 5 in at least psychiatry. In internal medicine, these could be widely different based upon how good your department is.
A couple of years back, a student of mine gave me a statement, so I'll just recheck it with you. The statement was very simple, that, sir, what is happening here in US is basically 10 years, minimum 10 years ahead of the whole of the world. Would you agree with that statement?
I think before I would definitely agree. Right now, I would disagree because of it really depends, right? So in certain parts of the US, right, US is different all across the world. It's not as true, right? India and US are pretty much equal, I will say. But in let's say, if you go to a city like UCSF, the level of medicine there is like 20 to 30 years ahead than what you will see, right? An example I can give you is something called as the SAINTS protocol, which is a TMS protocol for depression, which has a 80% remission rate. Like SSRIs only have a 40 to 50%. SAINTS has a 80%. And nowhere in the world can you find that. And most countries are about 30 years behind where Stanford is. We also have neurofeedback, which is, so your brain wants to get better, but it doesn't know how to get better because brain is the only part in our body which doesn't have sensory, nerves to know what's happening. So you could project brain waves into an external device and basically meditate. And for example, you have PTSD and nightmares and flashbacks. You can see how brain waves change. And then through breathing, you could change your physiology, which changes the PTSD itself. So we have crazy things like that happening in like, for example, California, UCSF. So right now, I would say very volatile based upon where you go. And right, for example, in small towns, not as much, same as India, but big places, it's 30 to 40 years ahead now.
So if I just talk about your own branch, which is psychiatry, post your postgrad, what is your life going to be like? Like, what's the career?
The career trajectory. So it really depends where I want to go. So in the US, just like India, if you go to a rural area, you get paid higher and you work less. If you go to an urban area like New York City, you're made to work more and you get paid less. Funnily, right? I plan to go to an urban area because I value networking. I think your network is your net worth.
True.
That's the best quote I've heard. So want to go there.
I made up that quote.
We'll be working about... What?
I made up that quote. So
you did?
Yeah, I did.
That's where I got it from, maybe subconsciously. Yeah.
Okay, just kidding.
But even in New York, generally you work 8 to 5, right, for 4 days a week. Generally, if you want to do, many people go part time. They only work 2 days a week. Some people work 6. Like for example, they'll work for 6 months. And then the next 6 months are off. And the salary is still like 350, 400,000, right? So I plan to do like something like 4 days a week. And the next 3 days would be geared towards learning more business skills that I want to learn about. AI is something I want to learn about, right? And going to like a place like Columbia, networking. The AI is going to change medicine we don't know what's going to happen. And I want to be on the frontier of that. And that's kind of why I want to balance my life. And I think this is what people don't understand in the US. What you're not just getting is the money, you're also getting a lifestyle which is unbeatable, right? Like my parents made good money, but they were working 7 days a week on their job. They had no option. Here, I have the time, the brain space to develop other skills, right? In those 3 days that I have off, one day I can chill. The next 2 days, I'm working on something else, right? So that you can't get in other countries that you can get in the US. True. And I think that's what I value the most is the time.
I would really like to say at this point that I'm really impressed and I really respect the way you have ventured out apart from just being a doctor. You are into so many things and I'm really impressed by that. So hats off to you for it. Because I know how much you have to be passionate about something that you are not going through. You could party on the weekends and you could do a lot of more things, but you are putting that time in building extracurricular skills, AI and everything. Sounds easy, but I know how difficult it is for a doctor. We are not from the coding background. So to understand everything, it takes a lot of extra effort. So hats off to you for that.
Yeah, but like I was telling you, right? For example, you asked me what is the best thing somebody can do for their CV, right? I think when you can't win by being the best, you can win by being different. So developing extracurricular activities like learning AI, right? A lot of people in the US who are 75, they're leaders, but they don't know technology. If you know AI, if you know these skills, you will be way ahead of your competition because these people want these people, the young mindsets, right? Who have things outside of medicine. So one of the things PDs look for here is do you know how to code Python or do you know how to use AI? Because that's what is missing for them. That's what they can't figure out. So I think that's one of the another things people can do to boost their CV is just learn other things that other people might not know.
Let's talk about you cracking USMLE. Now you are a perfect role model for like every USMLE aspirant in India. You cracked step 1 and you cracked step 2 with 271 without any coaching. So how would you define the perfect USMLE step 1 and step 2 strategy? So when should a person start and what's the right time to give the examination according to you and what should be the preparation strategy?
Yeah, I think a big part of your USMLE strategy should be a principle called as encoding variability. So what happens is when you're learning, the more novelty you can add to the learning, the better you will perform. An example I can give you is this. When you are watching, let's say you're playing a game. why do people play games for 12 hours, right? And they are able to learn everything without any repetition or any revision. The answer to that is encoding variability, right? So they're getting exposed to one concept in the game through multiple angles. And because of that, you're getting novelty, right, which your brain loves, and you're not getting bored with revisions. So a principle that I used was, I wasn't just like, I was doing Najib, right, in the background. So he would teach me a concept in a certain way, I would understand it. Okay, some concepts I couldn't understand. Then I would open Boards and Beyond, and he would teach it in a different way, and I would understand it now, right? And whatever concepts I understood from Najib, he would add extra angles to it, and it would also serve as a revision. So I think something that's really helped me move up in medicine is just addressing different topics, right, with different angles from different courses. I would take courses for, let's say, EKG, right? I did Najib's course. Then I would do osmosis sometimes because I didn't understand it. And just using all these different examples rather than repeating the same resource over and over again is, I think, the way to learn some things better. That's how I'm also learning Spanish. The way I'm learning Spanish is I have this subscription called Lingopie. And they teach Spanish through their shows. Like, they have their own shows. They give you Spanish audio and English subtitles. So you're able to like click it and what does this Spanish word mean and what does this not mean. So I'm learning each word through multiple TV shows, and it's getting repeated, so I'm not getting bored. So I think one of the best strategies you can do is mix up resources rather than just keep revising the same resource. I know that's kind of counterintuitive for many people, but that just helps me study without getting bored. I think that's a strategy. If you can just go through Kaplan if you want ever, it doesn't take a lot of time. That also will add to other dimensions of your understanding, right? So that's the strategy I would say, is use encoding variability over
you
revisions.
Get more fascinating with every answer, I must say that. Spanish.
Thank you.
Spanish, come on.
That's a popular opinion.
That's lovely. So every IMG talks about USCE, all right. Now, but how many types are there, and how does an IMG go through all of them?
So my knowledge keeps growing every year. So based upon that, the number of USCs will keep growing, right? Initially, I used to think there were 4. Right, these are divided into hands-on and hands-off. So within the 4, the hands-on ones are like, first of all, is sub-internship. Sub-internship is like being an intern in India. Right. So you're allowed to intervene at that level. You're allowed to give injections to the patient, do interventions, right? Do like plasmapheresis or any procedure you can think of. And also you are part of the treatment team. You can make recommendations, right? And that gives you the best letter of recommendation because they can say more things about you. Second level of hands-on rotations are electives, which you can only do as a student. The reason that is so is because the insurance system here protects students more than it protects graduates. So they allow hands-on experience touching the patient if you're a student. Electives are something you can do in your medical school or your internship. Third level is externships, which are basically hands-on experience for graduates. These are rarer, and these are more limited in terms of intervention compared to sub-internships or electives. This is something you do after you graduate. But again, there are problems with this. I would say sub-internships and electives are the best here. Hands-off are observerships or shadowing, which is the fourth one, where all you do is observe the physician. You're not allowed to touch the patient. You're not allowed to say anything there because of insurance issues. So that doesn't give you the best letter of recommendation, which you need to match, right? There are other types of USCE that I've found out about recently. One is research fellowship, where you come to the US and you would do research in a cutting edge field. For example, psychiatry, I would start doing research, translational research, where I look at mice models and see what drug is doing what new drug, like, that's an example. This can also earn me other opportunities to do other USCE in the university because it's like a favor. Then there's the research electives where you come to the US, do like 2 months of unpaid research elective as a student. Research fellowships can be paid. Research electives aren't paid, right? Technically, research fellowships, you need to be a graduate. Research electives, you can be a student. Then there's also assistant physicians. For example, if you are not able to match, if you have a green card, you can work under certain physicians as a physician, but like as an assistant to them. Those are other options as well. Then there's like other terms other than assistant physicians as well, like those are the most important ones. Then I think if you want the others, you can just watch my videos. It's too long.
All right, guys, to all my audience,
Yeah.
please do watch Dr. Manik's videos. They are very informative, very educative, and again, I am a fan of them. I am sure all my audience must be a fan of Dr. Manik as well. So,
And subscribe.
like,
So
share,
not
and
just
subscribe.
watch, subscribe.
That's
That's-
the whole thing. So, okay, I think cracking the interview is half the story here. So, what will be your top 5 recommendation and or advices to an IMG to get matched to the best hospital in 2025?
So, Dr. Bhatia, this advice is something that I've learned. Do you know what's emotional
Yes.
quotient or EQ? Yep. So the quote that I really love is IQ gets you the job. EQ is what gets you promoted. I think what international medical students aren't trained on the most is their emotional quotient. Right. What happens is if you look at any industry, Elon Musk, if you look at Sundar Pichai, or people who achieve like crazy things, and even in medicine, they're not the people with the highest intelligence. They are the people with the highest EQ. They know how to understand other people's emotions. They know how to control their own emotions. Right. So that is a skill that I would say you can master. And a part of mastering that skill is improving your communication. So taking communication classes on how to like connotation versus denotation, how to phrase things in a way that doesn't offend other people, right? And that will help you network within India or other countries if you're an IMG. And then once you come to the US, it'll help you make a better impression during a conference with some person who might like you and suddenly is like, hey, why don't you come do a free rotation with me, right? Why don't I write you a LOR? Why don't I help you in matching? So I think the best thing somebody can do is master emotional quotient, right? Which is just building your own emotional awareness, understand metacognition, right? Understanding yourself and then using it to understand other people, and then working in a way where you're not just pushing yourself for the goals, but also helping other people reach their goals. Because nobody wants to help somebody who's just in it for themselves, right? So I think that is the number one thing people can do. Second, I would say you can learn a second language like Spanish. If you know Spanish in the US, it's a big hand up because that's the second most spoken language, right? So Florida loves Spanish speaking IMG. So if you know Spanish, you'll get like a very big hand up in the whole match process. Third thing is research. This is something we are not as trained upon. So indulging in ICMR projects, learning how to do meta-analysis. If you can come to the US, do research. It can also help you get paid. For example, if I have good research skills, I can do research fellowships, and you get paid $70,000 to $80,000 to do research, and that gives you like helps you play the infinite game. Because if I have a research position, I'm getting paid. Now, all of a sudden, I have enough money to last as long as I want in the match. I can spend 15, 20,000 every year, and I'm not afraid what will happen. So I think if you want to guarantee your match in the end, I think research positions are amazing, learning research. Fourth, I would say is learning, just meta learning, how to learn, because USMLE is a big process. There's so many books to review. So just learning how can I learn better, right, without forgetting. I think that's very, very important. There are books on it like Walking on Moon with Einstein that helped me learn better and not forget information. And lastly, like I think the fifth skill is social media. I think if you know how to scavenge social media, how to network through social media, it is such a big thing. Like learning how to use LinkedIn can give you so much leverage. An example I can give you is I had a big social media presence when I was doing USMLE. And because of that, I was able to fetch research opportunities. I was able to fetch like electives for free, right? Because I knew people. And then also interview process. And I was able to match because of some of my social media presence. So mastering social media can also give you a big leg up.
Made networking work for you. So that's crazy impressive.
I think everything in life is networking. I just feel so bad in India. We're not taught that. Like our syllabus doesn't include networking. If you look at in the US, none of the CEOs here has an IQ of 170, 180. It's the way they talk, the way they can inspire teams, the way they can understand how to, for example, if you're an employee of mine, I need to make sure that I think about your goals when I'm giving you advice and I'm working with you so I can push you in terms of reaching your goals. And that's when you'll work the best with me. So we're never taught how to think in that way. And we are instead taught in very that crab mentality, कि मैं आगे निकल जाऊं and ये पीछे हो जाए, which is the opposite of like the way you grow in life. Right. So I think that like just knowing how to network is the biggest superpower you'll ever have. Like, because you can't so there's a quote by Ali Abdal I really like. He says that if you want to go fast, you go alone. But if you want to go far, you go together, because you can't reach big goals without other people.
So how would you describe like the the most difficulties or challenges which Indian students, apart from the ones you have just described, normally tend to face while they're going through the process of matching?
The number one is just shifting from a student mindset to a professional mindset, where what you will see is in India, we have just this concrete thinking: score, match, score, get residency, right? But here, just shifting from that like single-minded perspective to a whole multi-dimensional perspective of what makes a good person, right, and a great applicant is something that's missing. And just like for me, that was the hardest thing to make that change, because I was never trained in that. Secondly, I think networking is one of the biggest problems in India. We're not taught how to help other people. We're not taught like how to inspire other people, which is very, very important in the US in the end. And I think thirdly, the infinite mindset. So like there's a in philosophy, there's thinking of finite mindsets versus infinite, like the games you play, finite games versus infinite. A finite game is like a football match. Somebody wins or loses, right? So USMLE match is a finite process. You will win or lose by matching or not matching. NEET is a finite process. You can win or lose by match, like, getting your specialty or not. But the infinite game is different, that it doesn't have winning or losing. All there is growth, right? Infinite games are art. It's science. It's research. So what I would advise everyone is to play that infinite game, where you're not playing it just for the matching sake, but also growing in terms of just becoming a better person, opening up yourself for research and finding out like, how do I play the infinite game so I can play the finite games, right? If I have a source of money, right? For example, every year $50,000-$60,000 आ रहे हैं मुझको, then I can play the match as many times as I want, and I'm not afraid of क्या होगा भाई कि मैं नहीं मैच हुआ, right? और नीट में मेरा ये नहीं हुआ. So I think that is a mindset shift that if you can get, will make you unstoppable. I think. And lastly, just interviewing, like many Indian candidates I've seen, they don't know how to present themselves. I did not know when I was starting out, but just like knowing how to phrase things, the difference between connotation and denotation. Like you can say, you're an idiot in so many ways. Like you're an idiot, right, means not as serious, but then you're an idiot means like the tonality changes and the way you communicate shifts what is the meaning of it, right? So knowing how to frame things in a different way so people are not offended, because patients, like in the end, you'll get sued by that patient if you don't know how to frame difficult conversations. And then I think that's something that's lacking. So taking communication classes, Udemy पे इतनी सारे free courses हैं, right? You can just take that and see. It'll help you everywhere in life. I think those are the most important things anybody can learn.
Thank you very much for that. That tonality part is, again, something which you normally tend to miss, but you have highlighted it very beautifully. I must say that. An inspiring message for all, I think, every student in the world who is preparing for USMLE, whether they are an MBBS first year or an intern, or, a couple of people after a couple of years after their internship, what would be your message to all those people?
I think I have two messages. The first one is something that I think has really helped me in all aspects of life. It's be your biggest fan, because what happens is in the world, everyone will try to pull you down. And it's not that they want to pull you down because they're malignant. It's just because they have their own insecurities. And when they see you rising up, people will comment negative things on you, right? Because of their own projections that's happening upon you. So in that time when you are being like trying to being cancelled, or when other people are speaking against you, you have to be there for yourself. You can't be the person berating yourself, which is what I've seen a lot of people do. So a mindset that's always helped me is that I'm going to be there for me no matter what. No matter what anybody says against me, I'll be my biggest fan. Because if you're not your biggest fan, you'll be your biggest enemy. Because other people will never be your biggest fans compared to you. Secondly, I would say is don't ask yourself the question whether you're worthy enough of your goals. Ask the question whether your goals are worthy enough of you. So in India, like the mindset I've seen is people who are even topping AIMS or NEET PG, unka mindset, it never goes beyond the specialty or their job. It never goes to the like 10x thinking, which is if I were to, let's say, scale this specialty to its maximum, where would it go, right? So they never get out of that employee thinking into like the business mindset, or never learn other skills. So I've always asked myself, if this is my goal, let's 10x it. Let's see what happens. So Google में एक thinking है Google की that I really like, and it's this thinking that 50% of your goals should have a 50% chance of your failures. You have to, like, it's called moonshots and baby steps. So 50% of your goals should be moonshots. You have to fail. You have to fail forward, because that's how you learn. That's how you succeed like big in life. And you have to be willing to other people will make fun of you for that. And that's their problem, right? Their own insecurity coming in. And I understand that. But you have to be willing to be your biggest fan and go beyond what your expectations of a goal are, because you deserve better always, right? And it's always possible, right? It's in the word, right? If you say I am possible, it says I am possible, right? So I would say never restrict yourself to what you think is possible, and always ask yourself, if I 10x it, how am I going to make it happen?
Thank you so much, Dr. Manik. I believe you are a fabulous person who has done an amazing podcast today, covered everything about MLE, the whole US process. And again, the best thing that I liked about you is the way you have ventured out. You have not just put medicine in front, and you are doing all the crazy shit that's out there in the world. Thank you so much. But the podcast is not over. We are now moving to the rapid fire round. So I'll ask you some couple of spicy questions, and there are just two rules there. You have to be super spontaneous and super truthful. All right. So are we ready here?
Indian spice, that's what I was missing. That's
okay. What's the one thing you miss?
Biryani. Yeah. Give me the biryani. Yeah.
With the lychee. So what is the one thing you miss most about India except food?
I think the people, like this is something I struggle with here is the loneliness, right? For example, in India, there's 1 billion of us, right? And sometimes we think ki like space hi nahi hai, kash zyada space hoti. But in the US, like where I live is like you go out into the parking lot, there's literally no one. And I never knew loneliness until I came to certain parts of the US. It's not everywhere, but I just like miss the people, like jo unki sweat ki smell, right? Things I take for granted. It's just like so oxytonergic. It's so much love, like with so many people around. Like you will never, like US you need a therapist. In India, you never need a therapist because there's always somebody, right, present. So I think just the love of people.
Everywhere. That's India.
You don't need to pay for therapy. That's what I miss about India.
What's the last thing you binge watched?
Last thing I binge watched, I'm watching this show called Abbott Elementary, which is about a bunch of black teachers in a school which is underfunded, and the way like they venture into illegal stuff to make the school run. So it's super funny. Highly recommended. But course-wise, I'm watching this course by Mindwell. It's called Social Media Mastery. It's a great course that teaches you how to use AI to scale on social media. That's something I also watch, like binge watch. But yeah.
One decision you are really proud of?
Every decision which was high risk, and even like no matter if I failed or if I succeeded, I think I'm the most proud of like moving to the US, right? I was like initially from North India, moved to South India. So just taking that risk of changing your environment and moving and betting on myself is the, like just believing in myself, having faith is the best decision I've ever made. Like coming to the US, just trusting my gut instinct.
The most awkward video you've ever made?
Most awkward video. So if you see my second video where I talk about how to deal with exam anxiety on YouTube, I haven't taken a shower, like my haircut is off, and I'm wearing some like a bad t-shirt, which is like torn. And I'm like giving advice on how to not have exam anxiety and talking about my experience where I used to vomit like before exams. I think that's the most awkward video I've ever made. If you ever want to make fun of a video, highly recommend that video.
Okay, one creator you would love to collab with, other than me, of course.
other than you. Do you have a twin? But okay, so one creator I would love to collab with, I think Jordan Peterson. Like he is somebody who really inspires me in terms of psychology and like his concepts, the way he phrases things. He would be like one of the biggest creators I would want to collab
my team
with.
listening to the podcast is like this. Super impressed again. Okay. Do you carry anything Indian in your backpack daily?
Indian in my backpack. All right, that's a hard question. I sometimes get those meals, like we have a dal makhani pre-made meal that I get from a supermarket here that I'll carry because my favorite food in India is dal makhani, and that's something I can't just pass. So that's something that I carry at times. But yeah. And yeah, I also carry some Indian rupees for some reason. There's like some Indian rupees and pesos in my purse still. So yeah, that too.
I think you carry something of your home back in here, so you know that okay. कहीं भी आ जाओ, अपना देश अपना होता है.
Yeah, once an Indian, forever an Indian. That's how it works.
Thank you so much, Manik, for this amazing, lovely, fantabulous podcast. I think it was super educative, and I got to know you as an amazing person, which is the best part of today's, complete conversation. Thank you so much for being a part of the Nachiket Bhatia Show, and huge respect for what you're doing for all the Indian USMLE aspirants. Thank you so much.
Yeah, and guys, please make sure to like, subscribe, and comment on Dr. Bhatia's video. Never forget that.
So thank you so much, everyone, for watching today's show. I believe that every bit was just amazing. So much about USMLE that I personally did not know, and I got to know it today. So I'm sure that each one of you must have loved every single bit of today's conversation. Thank you so much. And again, do not forget to like, share and subscribe. ऐसे ही कम्युनिटी को बड़ा करते हैं और बेहतरीन फैबुलस लोग लेकर आते हैं और अपनी इंफॉर्मेशन को और बेहतर करते हैं. Thank you so much for being a part. All the best. God bless you.